This is where the media is very, very important. And this is why we are now stepping up the ante. We're bringing these issues to the front burner, working with traditional leaders, working with grassroots politicians, religious leaders, to say that we have to create awareness. We have to increase awareness around how people can access care nearest to their homes. How can insurance schemes be better developed by the states? All the states are in one stage or the other of developing an insurance program that will reduce financial hardship for their citizens, right? The National Primary Healthcare Development Agency, the Federal Ministry of Health, under the Basic Healthcare Provision Fund, is working with all these stakeholders to make sure that the 55 billion that has been provided by the federal government is used for that same purpose. It will take strengthening primary healthcare, strengthening insurance. Both of them have to work for us to get basic healthcare. Increasing people's awareness is very, very critical. That is why we're working from bottom up, working with traditional leaders, religious leaders, community-based organizations, civil society organizations, private sector, to provide information to all communities, to all individuals around what their rights are in terms of asking for quality care in their basic health, in their primary healthcare centers. The primary healthcare centers must be designed, must be co-managed and evaluated by community members. The primary healthcare centers were meant to be people-oriented and people-driven. We're going back to those days when the primary healthcare center was the heartbeat of communities, so that ward development committees will drive the effort in the primary healthcare centers. We're taking baby steps, but we know that it will take the commitment of everybody. We know the political will is there. We know that our development partners, donors are in support of this, especially because they now see the commitment that government has demonstrated by providing the 55 billion. So we are very optimistic that in the not distant future, Nigerians will be happy with the quality of primary health care that they are receiving. The immunization that we're seeing, right, the progress in immunization that we're seeing is just a stepping stone. Okay. It is sort of a gateway to the broader issues around primary health care that we're addressing.
Well, we're all looking forward to this, but why is it that maternal mortality rate has not improved in the last 3 decades?
It is not correct to say it has not improved. I think we need to get it very clear. There has been an improvement, but the improvement has not been significant enough. It has not matched the kinds of investment that we have made, and we're not happy to see that we still have over 100 women dying every day in Nigeria due to pregnancy. So the way to capture this very, very clearly is, for example, in Western countries, when a woman is pregnant and she announces that she's pregnant, the next question that comes is, are you having a boy or are you having a girl? But I know that in Nigeria, in every language, once a woman announces that she's pregnant, it is a prayer and a wish for safe delivery, like she's embarking on a dangerous journey. Pregnancy is a physiological process. It isn't supposed to be a dangerous journey. And that is why we're increasing the awareness around how we can stop those 3 delays that lead to maternal and child deaths. The delay in taking the decision to go to a primary health care center or any health facility, the delay in actually getting to the health facility, and the third delay, that even when you get to a health facility, that you get adequate and good quality care that will ensure that the outcome of that pregnancy is a joyous occasion. So that is what everybody at the Federal Ministry of Health, the National Primary Healthcare Development Agency, the partnership, traditional leaders are saying that we have to do a whole lot more. Yes, progress has been made, but the progress needs to be escalated to a level where no woman should be dying as a result of pregnancy or childbirth. We're not talking about chickens. We're not talking about animals. Even for animals, you have to, be sympathetic when an animal dies from birth, right? every single woman who dies from childbirth is one woman too many. Any child under 5 who dies from perfectly preventable causes is one child too many. That is why we're going bold and making sure that we create a platform where we can coordinate all the fragmented approaches. That has been part of the problem sometimes, right? The approaches have been fragmented. But when we have a coordinating platform where everybody comes, we have one plan, we agree on one plan, we agree on the resources that can be used in an efficient manner, ensure accountability. It's not just a question of providing the funds, but ensuring that those funds are used in a transparent and accountable manner, making sure that people do their work. This is what all of this is about, so that we can now begin to see a rapid decline in the number of women and children dying. We've seen from immunization that we're making progress. We believe that under the leadership of the Federal Minister of Health, that we will make the same concomitant progress in maternal and child health.
Is there any connection between these rates, maternal mortality and infant mortality? Is there any connection between them and literacy levels?
Absolutely. You will find that in those places where maternal and child health is highest, the literacy level is lower, right? So most of the maternal and child deaths actually occur in northern Nigeria, in some of the southern states as well, where literacy level is low, so awareness is also low. So very important, and a proxy for this maternal and child rate is skilled birth attendant, antenatal attendants, right? In a number of places, you still have women who do not go for antenatal care. You still have a lot of women who deliver at home, where the cultural circumstances suggest that if you deliver at home in your room by yourself, then you are a strong woman. But in a number of cases, those attempts at delivering by themselves leads to death. And this is why we're going again to the grassroots, working with the communities to increase awareness that that is not the way to go, right? That there's a need to attend antenatal care in the primary healthcare centers that we're trying to boost and revitalize. That it is also important that when it's time for childbirth, they do it in an environment where you're well taken care of, where there are health workers that will treat the woman with dignity, with respect, with compassion. That is exactly what we're trying to do. But very importantly is the fact that there's a lack of awareness around what needs to happen. And this is why we're collaborating with the media to also send out the words out there. It's not just antenatal care that women need to attend, but even after delivery, that they need to take their children to the health facilities for immunizations and other basic child care interventions.
All right. Thank you, Dr. Schreib. We'll come back to you in a few minutes. We'll just take a very short break, and we'll come back to talk about how to move especially health to the rural areas, optimizing it the same way immunization has been optimized. We'll be back in a moment. Please don't go away. Welcome back. Dr. Schreib, that matter you talked about earlier about reducing infant mortality and the need for education of those in the rural area, this is not a conversation that's just starting. This is a conversation that has been on. But how effective has it been? How do we optimize this so that we continue to bring down the numbers as we ought to? I know you mentioned something earlier about the rate not matching up with the level of investment. How do we optimize this?
Right, so what we're doing is first and foremost refocusing our energies on how we can do better coordination, providing better leadership. Right, in the last 3.5 years or so, the Honorable Minister of Health, who is a renowned gynecologist, has made the issue of maternal mortality front and center of the policies that he's enunciated at the Federal Ministry of Health. And as an agency under the Federal Ministry of Health, we are saddled with the responsibility of providing primary health care oversight of the states. We've done a better job of trying to coordinate the efforts. So, for example, while we have platforms that coordinate our interventions from human resources, the financial resources, working with development partners and donors at national level, we have replicated this at the states and the local government areas, all the way to the communities, so that we're focusing really on the rural areas where most of these deaths occur. This was instrumental towards President Muhammadu Buhari launching the CHIPS program in Nasarawa in 2018. So what did that mean, right? So the CHIPS program, which is an acronym that stands for Community Health Influencers, Community Health Influencers, Promoters, and Services, is actually a harmonization of all the community-based health workers, all the community-based interventions that were fragmented and in different pieces. With the launch of that program, in places where we didn't have adequate community health workers, we're recruiting community health workers. But the whole objective is that how do we provide basic health services in the rural areas where there is no doctor, where there is no midwife, so that if a woman is pregnant, she'll be attended to by these CHIPS agents. So these CHIPS agents are typically women who have been identified by their communities as very upright, as people who can be trusted. We train them for a period of 4 to 6 months on how to provide basic health care. So in that rural area where there is no doctor, no nurse, where they're completely cut off, maybe due to bodies of water or poor roads, there's somebody in the community that can attend to a pregnant woman, for example, if she's bleeding, by providing misoprostol, the wonder drug that helps stop bleeding during pregnancy, while arrangements are made for the woman to move to a primary healthcare center or any health facility nearest to the community. We are also seeing an improvement in the numbers of people that have been attended to in our primary healthcare centers, especially in those states where we've started the Nigeria State in Health Investment Program, the NSHIP program, in collaboration with the World Bank. We've seen how we've been able to provide basic healthcare to over 2 million Nigerians in those states where we've started. In those places, you could see that before we invested in the primary healthcare centers, they didn't have drugs, they didn't have commodities, the primary healthcare centers were dilapidated. But now, even in the most rural areas, we have renovated those health facilities, provided equipment, we're paying the utility bills on time, there's electricity, there's water. So there is progress. Okay. But what we're saying is that the progress is not as much as we would like to, and this is why the Honorable Minister of Health is focused on ensuring that we continue to make progress, that we sustain this progress, and ensure that even after our development partners leave, that we've been able to put in enough domestic resources that will ensure sustainability.
Thank you very much. Dr. Schreiber, I'd like to, we've run out of time, but I'd like to thank you so much for coming on the show, tell us what is happening at the primary healthcare delivery stage of our health sector. Dr. Faisal Schreiber is Executive Director, CEO of the National Primary Healthcare Development Agency. Thank you for speaking with us. Sunrise Daily Sunrise. We'll be back for the home stretch. Please join us again.